There is a very, very close connection between mental health and financial stability. One can cause a problem for the other, and vice versa. It's a difficult area to put a price on when you're dealing with any sort of mental health challenge or burnout. But our next guest actually did the calculation. Olga Morawczynski is the co-founder of Heal 3. She is a mental health advocate. She joins us now from Aurora, Ontario, to talk about her own journey and what she found the total was when she added it all up. Olga, hello.
Hi, Bruce. Nice to be here. And thank you for looking at mental health from a financial lens.
You're welcome. We're talking, I mean, we've talked before, but we're talking today because of a post you put on LinkedIn, actually articulating the cost. And it wasn't even an exhaustive list. Before we get to those numbers, give us a sense of your own experience with burnout. How did it manifest for you? What was life like in that time?
Yeah. So maybe just in terms of context, I mean, at that time, I was so driven and productive. I was working all the time. And I don't think mental health or illness was in my lexicon at all. But I had a moment where I woke up and I physically, emotionally, I could not get out of bed.
Mm.
And I had indicators and symptoms over the past few months that something was wrong. I had, tons of stress. I was unable to sleep. I was always sick. I guess I thought I was burnt out, as you said before. And it got to a point where it got obviously pretty bad. And that's when I started working with a therapist. And she was direct. And what she said to me, she said, Olga, what happened to you was your fault because you didn't take action sooner. What she also did, actually, interestingly enough, was that she made me calculate the cost. 6 months later, after working with her, she made me calculate the cost of not being able or getting myself into that situation and not being able to take care sooner. So I can tell you more about that if you're interested.
Can I make the assumption that when she was so direct with you about your role in your current
Yeah.
circumstance, it was empathetic and warm and kind? Because hearing just that sentence sounds a little abrupt.
It was with the best of intentions,
Okay.
and I'm so glad that she did that. And it was also a precursor to showing me just how much it cost me by not taking a preventative approach to my own mental health.
There is so much that's within our circle of control, much that
Yeah.
isn't, but so much that is. She challenged you to tally it up. What did
Yeah.
you factor in to that math?
So it was about a 6 month period of treatment. So I'm only talking about the treatment period. And I just want to say I continue to invest in my mental health today. So the cost is more, but it's far less because now it's preventative, right? So I never get back there again. I lost during that time 28 days of work. I lost $200,000 in revenue from canceled contracts and missed opportunities. I was self-employed at the time. And I spent $12,000 on my recovery. And only a portion of that was subsidized by my partner's benefits. And I can break that down, but 3,000 went to therapy. I spent about the same on naturopathic and functional medicine. Some went to alternative therapies. I'm a big cold plunger. That helped a lot. Somatic breath work, wellness retreats. I mean, the list goes on and on and on. But it was approximately $12,000 for not taking a preventative approach. And I'll tell you kind of one quick thing, because this is an important distinction. There is mental health, and mental health is simply how we're feeling today, right? And sometimes we might be stressed or not. And then there's mental illness. Mental illness is a diagnosable condition. Burnout is not a diagnosable condition. It's just kind of a series of symptoms. And if we get to mental illness, that is when it starts to get expensive, because that's when we can't work. That's when we need treatment. And that's a very different ballgame.
It is a place of privilege. I'm sure you'd acknowledge that you were able to
Yes.
spend that
Yeah.
$12,000. Many people, that is all the money for food and all the money
Yeah.
for rent in a country that has universal health care, but it doesn't cover a lot of the things that you mentioned. For people in that circumstance, how do they engage in this question of cost benefit? Because they're going to be making real trade-offs.
Right. Well, I think the most important thing is to definitely try not to get to the point where you are so mentally unwell that you are at the point of mental illness, right? So trying to invest in preventative care if you can, utilizing your employee benefits, understanding what's in there if you have an employee assistance program, or if you have coverage for mental health practitioners, if you have a flexible or health spending account that can cover things, use that all the time. The minute you things start getting uncomfortable, see how you can utilize it, and also see what's available in terms of public health care within your own community. There are a lot of free resources that you can access when you start feeling that perhaps you're not in a great place.
I had a drippy faucet. I eventually put a bucket under the counter to deal with the drips in the faucet. And one day I woke up to a flooded basement, drywall all over the place because the
That's
pipe had
right.
actually burst. And if I had only called the plumber when I saw the leaky faucet, I wouldn't have had to pay that. As you use that example to think on your own experience, were there some early indicators, some warning signs that for whatever reason you ignored?
There was 10 years of early indicators, and they weren't at a point early anymore, right? And that is absolutely, I think that's very normal. We are all so busy. We have lives and we have jobs, and until you need a renovation in your basement because it's falling apart, we often don't take that type of care that we need. And I do wish, for many reasons, I was lucky because I had a dream car fund. So that's where that money came from. Until today don't have that dream car.
Right.
But if I hadn't had the dream of that car, I perhaps would have a much higher debt related to
Right.
the treatment
And
plan
am
that I
I
had to
right
go
to
through.
surmise that you're happier to have your mental health back than the dream car? Is that a
I am very
fair?
happy to have my mental health back, but I still want that dream car one day.
As you think about how so people who are making ends meet and they are able to think about budgeting and they're budgeting and saving for lots of different things, how would you encourage them to invest in I'm using air quotes, the maintenance of their home such that that leak doesn't occur, such that all of those symptoms don't add up to something that's almost catastrophic?
Yeah, well, I think first of all, let's prioritize it, right? I mean, it's what's the difference between breaking, a leg and being mentally unwell? We need rest, right? We need to talk to our employers. We need to utilize those benefits, as I said before, and we need to admit to ourselves that something is not right and that we do need to take care and take the time to address it. And please, let's not feel guilty about that, right? Whatever those costs are, please let's not feel guilty about that. I probably think that is the most important starting point.
Mm.
And then over time, it's simply maintenance, right? Finding which modalities work for you. Almost half the population is treatment resistant, right? That means that they don't react to talk therapy or medications. There are so many different modalities out there. I know it can get expensive, but through a little bit of experimentation, there are things within your budget and things eventually that you can really find. And maybe things don't even cost you anything. Connection with community, a walk in the forest, that can make a lot of difference in terms of how you feel.
Did you have a predisposition to openness about trying different things, or were you really just at your wits' end? And so, like, someone said cold plunge and you leapt right in.
I tried everything because it felt so uncomfortable for me at the time, and because I wasn't used to not being in control of my own my own mind, my own body. And that's what mental illness does, right? So I don't necessarily know if I had a predisposition, but being honest, at the time, talk therapy wasn't it. It wasn't enough for me. That's why I had to try. And there's lots of new cutting edge modalities that are coming up now. It's such an exciting time in mental health, right? And I'm hoping that they can be a critical part of employee benefits of our public healthcare system, so we do get the support that we need.
Thank you for joining us and sharing your story. We talk so often at a macro level about the cost of mental health in our culture, but what's particularly compelling is you putting a face to it and giving us real numbers that you actually had to pay out of pocket to get yourself back on track. So thank you so much for doing that today.
Thank you, Bruce, for raising this important issue.
Yeah, it's critical. Olga Morawczynski is the co-founder of Heal 3, and she was here to talk about the cost of her mental health, not in some ephemeral, abstract way, but in dollars and cents.